8 months of normal labs, 8 months of clean scans, unremarkable blood work, and a patient who kept coming back to the ER saying the same thing over and over again. Something is wrong with me. And every single time, the doctors sent her home. But on the night that a second-year resident asked one question that nobody else had thought to ask, everything changed. What she discovered wasn't just a diagnosis, it was a cover-up. But to understand how we got here, I need to take you back to the beginning, back to the first time Margaret Chen walked into the emergency room at St. Vincent's Medical Center in suburban Philadelphia. Back to a Tuesday afternoon in March, when a 54-year-old high school English teacher with no significant medical history did something she'd never done before. She asked for help. Margaret Chen had been teaching for 28 years. Shakespeare, Hemingway, Toni Morrison. She was the kind of teacher who stayed late to help students with their college essays, who remembered every single kid's name for decades after they graduated. Her colleagues called her the Iron Lady, not because she was cold, but because in almost 3 decades she'd never taken a sick day. So when Margaret called in sick that Tuesday morning, her department head Sarah knew something was seriously wrong. Margaret had woken up at 4 a.m. with what she described as the worst headache of my entire life. Not a migraine, she'd had migraines before. This was different. This felt like someone had poured hot concrete into the base of her skull, and it was slowly hardening, pressing against her brain. And there was something else. Her left hand was tingling, not numb exactly, more like television static running under her skin. By 2 p.m, she couldn't take it anymore. Her husband David drove her to St. Vincent's, and that's where she met Dr. Richard Holloway for the first time. Dr. Holloway was the attending physician in the ER that afternoon. 15 years of experience, board certified in emergency medicine, good reputation. He took one look at Margaret's chart, noted her age, noted that she was a teacher, high-stress job, and asked her a series of standard questions. Any recent trauma? Falls? Car accidents? No. Fever? Chills? Neck stiffness? No fever, but yes, my neck has been stiff. How much water have you had today? Margaret paused. I don't know, maybe 1 glass? Dr. Holloway nodded like he'd just solved a puzzle. Mrs. Chen, I'm going to order some blood work just to be thorough. But honestly, this sounds like a tension headache combined with dehydration. High-stress job, not drinking enough water, probably been staring at papers all day. Very common in educators. Margaret wanted to argue, wanted to say that she'd had tension headaches before and this wasn't that. Wanted to explain that the tingling in her hand had started 3 days ago and hadn't stopped. But Dr. Holloway was already scribbling on his prescription pad. I'm going to give you something for the pain. Drink at least 8 glasses of water a day. If it's not better in a week, follow up with your primary care. The blood work came back. Everything was normal. Margaret went home. She drank water. She took the pain medication. And for about 10 days, she felt okay. Not great, but okay enough to go back to teaching. Okay enough to convince herself that maybe Dr. Holloway had been right. Then it came back. Worse this time. The headache was constant now, a dull pressure that never fully went away. The tingling had spread from her left hand up to her forearm, and there was something new. Sometimes, in the middle of a sentence, she'd lose a word. Not forget it exactly. She could see the word in her mind. She just couldn't make her mouth form it. For a woman who had made language her entire life's work, this was terrifying. She went back to St. Vincent's. Different day, different doctor, same result. Labs are normal, Mrs. Chen. Have you been sleeping enough? Stress can do remarkable things to the body. She went back a 3rd time, 4th, 5th. By July, she'd been to the emergency room 6 times. 6 different physicians had seen her. They'd run complete blood counts, metabolic panels, thyroid tests. They'd checked her blood sugar, her kidney function, her liver enzymes. Everything was normal. Here's the thing about normal lab results that nobody tells patients. Normal doesn't mean nothing is wrong. Normal means that whatever is wrong isn't showing up in the tests we're running. But nobody told Margaret that. Instead, by her 6th visit, she started noticing something in the way the staff looked at her. The way they glanced at each other when she came in. The slight sigh before they asked her what was wrong this time. She heard a nurse whisper, "frequent flyer," once when she didn't think Margaret could hear. And I want to pause here for a second, because if you've ever been a patient who knew something was wrong, knew it in your bones, and had doctor after doctor tell you that you were fine, this is the part where Margaret's story is going to hit different. And if you've ever been on the other side, if you've ever worked in healthcare and had to deal with patients who kept coming back for reasons you couldn't find, I think you're going to see something in this story. That changes how you look at both sides. What nobody in that ER knew yet was that Margaret's chart had already been flagged in the system. Not for a medical condition, for something else entirely. By September, Margaret had stopped going to the emergency room. Not because she felt better, because she'd given up. She'd reduced her teaching load to half-time. She'd stopped driving because the tingling in her arm made her feel unsafe behind the wheel. She'd lost 14 pounds because the constant headache killed her appetite. Her husband David watched the woman he'd been married to for 31 years disappear piece by piece, and there was nothing he could do about it. "The doctors say she's fine," he told his sister on the phone one night. "But she's not fine. I can see she's not fine, and nobody will listen." Here's where I need to tell you about Dr. Amira Hassan. Amira was a second-year resident in internal medicine at St. Vincent's. 29 years old, top of her class. At Temple, the kind of young doctor who stayed late reading case studies for fun. Her attendings loved her because she never cut corners. Her patients loved her because she actually listened. On October 14th, Amira was working a Saturday night shift when Margaret Chen came in for the 7th time. Margaret almost hadn't come. David had practically dragged her. "One more time," he'd begged. "Please, just one more time." Amira was assigned to triage that night. She pulled up Margaret's chart on the computer and saw the history. 7 visits, normal labs every time, and that little yellow flag. The flag was a high utilisation alert. It was supposed to help staff identify patients who might benefit from case management. But in practice, and Amira knew this, it often meant something else. It meant, be careful with this one. She might be a complainer. She might be looking for attention. She might be wasting your time. Amira looked at the flag. Then she looked at Margaret, sitting in the wheelchair. Thin, pale, left arm cradled against her body, eyes red from what looked like months of not sleeping well. And something in Amira's gut said, this woman is not a complainer. This woman is dying. "Mrs. Chen, I'm Dr. Hassan. I'm going to be taking care of you tonight." Margaret barely looked up. "Are you going to tell me my labs are normal too?" There was no anger in her voice, just exhaustion. The kind of exhaustion that comes from fighting a battle everyone tells you isn't real. "I don't know yet," Amira said. "Can you tell me what's been happening? And I mean everything. Start from the very beginning." For the next 45 minutes, Amira listened. She didn't interrupt. She didn't rush. She asked clarifying questions, but only to understand better, never to challenge or dismiss. She wrote everything down. The headaches, the tingling, the word-finding problems, the weight loss, the neck stiffness, the fact that it all started suddenly on a Tuesday in March. And then Amira asked the question that nobody else had asked. "Mrs. Chen, you said this started on a Tuesday. Was there anything unusual about that day? Anything at all, even if it doesn't seem related?" Margaret frowned. It was just a normal day. I went to work, I taught my classes, I came home." Did you eat anything different? Go anywhere unusual? Do anything you don't normally do? Margaret was quiet for a long moment. Then her eyes widened. I had a dental procedure. Amira leaned forward. What kind of dental procedure? A root canal. That Monday. The day before the headache started. But what does that have to do with anything? Now here's what I need you to understand about what Amira was thinking in that moment. In medical school, every doctor learns about something called infective endocarditis. It's an infection of the heart valves, usually caused by bacteria entering the bloodstream. One of the most common ways bacteria can enter the bloodstream? Dental procedures. But infective endocarditis has very specific symptoms. Fever, heart murmurs, skin manifestations, and it absolutely would have shown up in blood work. Margaret's labs had been normal 7 times. So Amira was thinking about endocarditis, but she was also thinking, that's not it. That's not the whole picture. And then she asked the follow-up question that cracked the entire case wide open. Mrs. Chen, after your root canal, did you take antibiotics? Yes, a full course. I finished them all. And did you have any procedures after that? Any other dental work? Any injections, IV treatments, anything where they put a needle in you? Margaret thought. No, nothing like that. Are you sure? Sometimes people forget small things. Blood draws at your doctor's office, flu shots, anything? Wait, there was one thing. About a week after the root canal. I'd been so stressed about some pain I was still having, and my friend recommended this wellness clinic. They do vitamin infusions, IV vitamins. She said it would help with energy. Amira felt her heart rate increase. Where was this clinic? It's called Renewal Wellness. It's in a strip mall over on Lancaster Avenue. Why? Is that important? And this is the moment, I promise you this is true, when everything changed direction. Now, what Amira suspected at this point, honestly, this is the part that still gets me. Because she was a second-year resident about to challenge a theory that 7 attending physicians had missed. And if you've ever worked in medicine, you know that's not nothing. If she was wrong, she'd be the resident who wasted resources and cried wolf. But if she was right... If you're still with me on this story, hit subscribe, because what Amira found goes way deeper than one patient. This case changed protocols at 3 hospitals in the Philadelphia area. But I'm getting ahead of myself. Amira excused herself and went to find the attending on duty that night. It was Dr. Nathan Cross, a veteran ER physician who had been at St. Vincent's for over 20 years. Respected, experienced, and notoriously difficult to convince when a resident had a theory. Dr. Cross, I have a patient I need to talk to you about. He looked up from his computer. The Chen woman? I saw she came in again. What's the story this time? Amira noted his tone. Dismissive. Already made up his mind. I think she might have a central nervous system infection. Possibly a slow-growing bacterial or fungal meningitis. Dr. Cross actually laughed. Her labs are normal. I've seen her file. WBC count normal, CRP normal, no fever, no classic meningitis presentation. She's had persistent headaches, neck stiffness, and neurological symptoms for 8 months, Amira said. And she had an IV vitamin infusion at a wellness clinic 1 week before symptom onset. That got his attention. Slightly. Wellness clinic? Renewal Wellness on Lancaster. I looked them up. They're not a licensed medical facility. They're operating as a spa, which means they're not required to follow the same infection control protocols as medical facilities. Dr. Cross was quiet for a moment. What are you asking for? A lumbar puncture, I want to test her cerebrospinal fluid. Now, I want you to understand what Amira was up against here. A lumbar puncture, a spinal tap, is not a casual procedure. It's invasive, it has risks, and ordering one on a patient whose labs have been normal for 8 months based on a theory about a wellness clinic. That's a big ask. Dr. Cross could have said no. A lot of attendings would have said no. Would have told Amira she was overthinking it, that sometimes anxious patients just have symptoms that can't be explained, that the wellness clinic was probably fine. Instead, he said something that surprised her. You know what? Do it. If you're wrong, you learn something. If you're right... He didn't finish the sentence. He didn't have to. The lumbar puncture was performed at 11:47 p.m. Margaret was scared. She'd never had one before. But there was something about Dr. Hassan, about the way she explained everything, about the way she seemed to actually believe Margaret wasn't crazy, that made her willing to try one more time. The procedure itself took about 20 minutes. Amira was meticulous, talking Margaret through every step. The local anaesthetic, the positioning, the pressure she'd feel when the needle went in. And then they waited. Standard cerebrospinal fluid, CSF, is clear and colourless, like water. When Amira pulled that first sample from Margaret's spine, it looked almost normal. Almost. It's slightly cloudy, Amira said to the nurse assisting her. You sure? Looks clear to me. No, hold it up to the light. See that faint haze? The nurse held the tube up. Her expression changed. I see it. Amira sent the samples to the lab with a priority flag. She also added a note requesting extended cultures, not just the standard 48-hour bacterial cultures, but the longer ones that could catch slow-growing organisms. And then she sat down with Margaret. Mrs. Chen, I don't have answers yet, but I believe you. Something is wrong. And I think we might finally be on the right track to finding out what it is. Margaret started to cry. Not dramatic, heaving sobs, just quiet tears running down her face while her husband held her hand. Thank you, she whispered. Thank you for listening. I need you to understand something about what happened next. When you order extended cultures on cerebrospinal fluid, you're not waiting hours. You're waiting days, sometimes weeks. The organisms that cause chronic meningitis, the slow-growing fungi, the unusual bacteria, they don't reveal themselves quickly. But the preliminary results? Those came back in 36 hours. And when Amira saw them, she immediately paged Dr. Cross. The CSF showed elevated white blood cells, not dramatically elevated, but elevated. Elevated protein and slightly low glucose. These are the hallmarks of meningitis. The same symptoms that should have shown up in blood tests. But here's the thing about slow-growing central nervous system infections. They often don't cause the dramatic bloodstream changes that acute infections cause. The infection can be walled off in the central nervous system, the body fighting a quiet war that never spills into the blood. Margaret's blood had been normal because the war wasn't being fought there. Margaret was admitted to the hospital immediately. She was started on empiric antibiotics and antifungals, a best-guess combination to fight whatever was growing in her brain, while they waited for the extended cultures to identify exactly what it was. And that's when Amira made a decision that would turn this case into something much bigger. She called the Pennsylvania Department of Health. I have a patient with a probable CNS infection following an IV vitamin infusion at an unlicensed wellness clinic, she said. I think you need to investigate this facility. The investigator on the other end of the line was quiet for a moment. Doctor, you said Renewal Wellness on Lancaster Avenue? Yes. You're the third call we've gotten about that clinic this week. Amira felt her stomach drop. There are other patients. I can't discuss active investigations, but if your patient can provide a detailed timeline of her visit there, that would be helpful to our team. What Amira didn't know yet, what she wouldn't find out until weeks later, was that Renewal Wellness had been operating for 3 years with almost no oversight. They offered IV vitamin infusions, B12 shots, immunity boosters, and something they called cellular regeneration therapy. They had no licensed medical personnel on staff. Their nurses were aestheticians with weekend certifications from an online program. Their IV supplies were purchased in bulk from an overseas vendor, and their sterilization protocols? Non-existent. But I'm getting ahead of myself. On day 4 of Margaret's hospitalization, the extended cultures came back. The organism was Cryptococcus neoformans, a fungus that typically causes serious infections only in immunocompromised patients, people with HIV, cancer patients, organ transplant recipients. Margaret Chen had no immune deficiency whatsoever. Her immune system was perfectly healthy, which meant she'd received a massive inoculation of the fungus, enough to overwhelm even a healthy immune system. Enough to establish a slow-growing infection in her central nervous system that had been eating away at her for 8 months. And she'd received it through that IV vitamin infusion. The infectious disease team took over Margaret's care. She was started on aggressive antifungal therapy, a combination of amphotericin B and flucytosine, drugs that are effective but come with serious side effects. For the next 6 weeks, Margaret lived in the hospital. She had headaches from the medication, nausea, kidney function that had to be monitored daily because the drugs were hard on her organs. There were days she felt worse than she had before the diagnosis, and she asked Amira once if it was worth it. "If we don't treat this, it will kill you," Amira said. "Maybe not this month, maybe not this year, but it will spread. It will keep spreading until there's nothing left to save." Margaret nodded. "Then we keep fighting." Meanwhile, the investigation into Renewal Wellness was accelerating. Health inspectors had raided the facility 2 weeks after Amira's call. What they found was worse than anyone expected. Contaminated supplies, reused IV tubing, solutions prepared in a back room with no climate control or sterile field, and records of hundreds of patients who had received IV infusions at that clinic over the past 3 years. Now here's the part where the story gets complicated, because not everyone who got an infusion at Renewal Wellness got sick. Most people, in fact, walked away fine. Their immune systems handled whatever bacteria or fungi they might have been exposed to. They never knew how close they'd come to disaster. But some people weren't fine. Over the next 3 months, the Pennsylvania Department of Health identified 14 patients with confirmed infections traced back to Renewal Wellness. 3 bacterial bloodstream infections, 2 cases of hepatitis, 1 case of septic arthritis, and 4 cases of cryptococcal meningitis. 4 people walking around with a fungal infection in their brains. 4 people who, like Margaret, had probably been told their labs were normal, that they were stressed, that they needed to drink more water. Margaret was lucky in one crucial way. She was diagnosed early enough that the infection hadn't caused permanent damage. After 12 weeks of treatment, follow-up lumbar punctures showed that the fungus had been cleared from her system. Her headaches were gone. The tingling in her arm was gone. The word-finding problems were gone. She went back to teaching that spring, full-time. But not everyone was that lucky. One of the other cryptococcal meningitis patients, a 62-year-old retired accountant named George Mendez, wasn't diagnosed until 18 months after his infusion. By then, the infection had caused permanent cognitive damage. He can no longer live independently. He requires full-time care. I don't know about you, but the fact that Margaret and George went to the same clinic, got the same infection, and had such different outcomes, that one sits with me. because the only difference between them was that someone finally listened to Margaret. Someone asked the right question at the right time. The owner of Renewal Wellness, a woman named Diane Hargrove, was charged with multiple counts of practicing medicine without a license and reckless endangerment. She pleaded no contest and received 5 years of probation and a permanent ban from operating any health-related business. 5 years of probation for ruining at least 14 lives that we know of. There are people who would say that's justice. Others would say it's a slap on the wrist. I'm honestly not sure where I land on it. What I do know is that Diane Hargrove is already consulting for another wellness brand in a different state, operating in a grey area that technically doesn't violate her probation. The system that allowed Renewal Wellness to operate for 3 years with no oversight, that system is still in place. But this story isn't really about Renewal Wellness. It's about Margaret Chen. And it's about Dr. Amira Hassan. After Margaret's case was resolved, Amira went back to her residency. She presented the case at Grand Rounds, the weekly meeting where doctors discuss interesting and instructive cases, and used it to highlight a phenomenon that has a name in medicine: diagnostic momentum. Diagnostic momentum is what happens when an initial diagnosis, or in Margaret's case, an initial dismissal, gets repeated so many times that it becomes treated as fact. Each subsequent physician sees what the previous physicians saw, accepts their conclusions, and moves on. Margaret's chart said her labs were normal, so every doctor who saw her looked at those labs, saw they were normal, and concluded that nothing was wrong. Nobody questioned whether they were running the right tests. Nobody asked if the normal values might be hiding something abnormal. Nobody started from scratch. Until Amira did. There's an expression in medicine: when you hear hoofbeats, think horses, not zebras. It means that common diagnoses are more likely than rare ones, and you shouldn't go hunting for exotic diseases when simple explanations exist. It's good advice. Most of the time. But Margaret wasn't a horse. Margaret was a zebra. And because everyone was listening for horses, nobody heard her coming. I talked to Amira Hassan while researching this story. She's an attending physician now at a different hospital. When I asked her about Margaret's case, she was quiet for a long time. I think about all the patients I don't catch, she said. The ones who come in with vague symptoms and normal labs, and I send them home because I'm tired, because there are 15 other patients waiting, because the easy answer is probably the right one. I think about how many of them might be someone like Margaret. I asked her what she learned from the case. Ask about timing, she said. Always ask about timing. When did symptoms start? What happened in the days before? People forget things. They don't think dental procedures or wellness clinics or flu shots are relevant. But that window, those few days before symptoms began, that's where the answer usually lives. Margaret Chen still teaches at the same high school. She's become an accidental advocate for patient rights, speaking at community events about the importance of trusting your own body. If you know something is wrong, don't stop until someone listens, she tells people. Be polite, be persistent. Bring someone with you who can advocate for you. And if a doctor tells you that you're fine and you know you're not, get a second opinion. Get a third opinion. Get a 10th opinion if you have to. Last year, Margaret sent Amira a letter. It arrived at the hospital, forwarded from St. Vincent's. Dr. Hassan, the letter read, I want you to know what your question gave me. It gave me my students back. It gave me my husband back. It gave me my life back. I teach a poem now, every semester, about listening, about how being heard is sometimes all a person needs. I think about you when I teach it. Thank you for hearing me. Thank you for asking the right question. Thank you for believing me when nobody else did. Amira keeps that letter in her desk. She reads it on the hard days. The days when the ER is slammed and she's exhausted, and there's a patient in bed 4 whose labs are normal but something feels off. On those days, she takes a breath, and she asks one more question. Stories like this one happen more often than anyone in healthcare wants to admit. The patient who gets dismissed, the diagnosis that gets missed, the resident who catches what everyone else overlooked. What gets me about Margaret's story isn't just that she was right all along. It's that the system was designed to make her invisible. High utilization alerts, frequent flyer whispers, the slow erosion of credibility that happens when you keep asking for help and keep getting told you're fine. It took one resident on one night shift asking one question about timing. That's it. That's the distance between Margaret's full recovery and George Mendez's permanent disability. One question. If you've ever been the patient who knew something was wrong before the tests confirmed it, if you've ever had to fight to be heard, I want to hear what happened. What was the moment someone finally listened? And what was the question that changed everything? The stories people send me about being that patient, or being the one who finally heard them, they keep getting more unbelievable. Subscribe if you want to hear what drops next, because every one of these stories matters. And Margaret's is proof that sometimes asking the right question at the right moment, that's not just good medicine, that's the difference between living and disappearing.